Hi everyone, I'm Professor Kevin Fenton, the Regional Public Health Director for London, working between the Department of Health and Social Care and NHS London. I'm so pleased to join this webinar today, which is really aimed at healthcare professionals, providing information about smoking and mental health, and really exploring some of the system issues which are preventing us making progress in this area. We know that often healthcare providers find it difficult to raise issues of smoking cessation within hospital settings and especially in mental health settings as well. So the purpose of this clip and this webinar is really to open the conversation up to healthcare professionals, giving additional information on the context of smoking, why it's important, and for us to explore together some of the issues related to how we collaborate and work across our health and care systems to help to reduce the risk of smoking. Now, in the audience today are many colleagues coming from a variety of backgrounds, people working in mental health, tobacco control, people working in the NHS, and many of you working in the community as well. And I want to thank you for joining us for this session today. I'll be covering why it's so important and what we can actually be doing about smoking in mental health settings. So, many of you know that smoking rates have greatly reduced over the last 4 decades, with a current prevalence of smoking in London of about 12.7%. But that still represents about 900,000 Londoners, each of whom will lose on average 10 years of life because of smoking. Smoking rates among people with a mental health condition are significantly higher in the general population, and smoking rates increase with the severity of mental illness. This, therefore, ranges from about 26% of people suffering from stress and anxiety challenges to 45% of people with a serious mental illness who smoke. So there's a vicious cycle as mental illness makes people twice as likely to smoke, yet makes them more vulnerable to mental health concerns. And we know that smoking drives 3 out of 4 of the top causes of early death in people with mental ill health. People with severe and enduring mental illnesses will die on average 15 to 20 years earlier than their counterparts. And there's a particular challenge that we have, which is that for smokers with a mental health condition, the association between smoking and feeling relaxed is generally more pronounced. So additionally, many people report smoking to help them relieve stress. However, the relief from the nicotine by using tobacco to self-medicate is only temporary, and in part this leads to even higher smoking rates. There has not previously been an awareness campaign in London that highlights the important issue of smoking and mental health. And so what we're keen to do is to encourage greater consideration of this public health issue and to encourage greater action, both from smokers and from those who work in London's health and care systems. Today, you're going to hear from a number of speakers who are highlighting some of the important and innovative work being supported nationally and in local systems to help to reduce smoking in mental health settings. This is a really important issue, since addressing the culture around smoking in mental health settings remains a challenge. I encourage you to participate in the roundtable and to consider what you can take back to your place of work to help to reduce the unacceptable levels of harm that tobacco has on our fellow Londoners. Thank you so much.